Good morning, good afternoon, good evening. My name is Marc Ruel. I'm the incoming president of the Canadian Cardiovascular Society, and today it is my distinct honor and pleasure to welcome you to this CCS focus on the cardiovascular leaders of tomorrow. It is my great pleasure to introduce to you our speaker for today, who needs no introduction. Her name is Donna Kimmaliardjuk. And Donna, as many of you may know, is a young cardiac surgeon who incidentally was trained in Ottawa and now is completing her advanced cardiac surgery fellowship at the Cleveland Clinic Foundation in Cleveland, Ohio. We're very, very proud of Donna. She was one of our trainees. She visited us first as a medical student in Ottawa and then spent 6 very fruitful years at the Ottawa Heart Institute and the University of Ottawa, and learned her art, science, and trade, as I like to say, of cardiac surgery, and now continues to impress, and I know this offhand from my colleagues and friends at the Cleveland Clinic through her new fellowship development in very advanced cardiac surgery, who also incidentally, as you may know, is, I believe, the first cardiac surgeon to have graduated from a Canadian institution. Donna, welcome to this podcast.
Thank you so much for the really kind introduction, and it's really lovely to see you. Since I left Ottawa 4 months ago, and with COVID, haven't been able to see many people from back home, so it's really a pleasure.
We miss you a lot, Donna. You had promised that you would come back to visit. So what happened? Must be this close border thing.
Yeah.
How are things in Cleveland?
It's great. It's busy. It's the Cleveland Clinic, but I absolutely love it here. It's a really special place. It reminds me a lot of Ottawa. Really special, fantastic, caring people here, all the way from the staff surgeons to co-fellows to nursing to support staff. It's really, really fantastic.
Donna, we have about 10 minutes to chat together today, and I know there'll be a lot of interest around what you have to say and the unique perspective that you bring to the cardiovascular leaders of tomorrow, not only for Canada, but I would say globally as well. Can you tell us a little bit about your background, where you come from, and what drove you to engage into studying medicine and even more specifically cardiac surgery?
Absolutely. So as you pointed out, I'm Inuk. Inuk is a singular word for Inuit. And my family's originally from a small community in Nunavut called Chesterfield Inlet. And so I lived up there for a brief period of time when I was a young infant, but my parents relocated to Ottawa solely for the purpose to provide their kids with better educational opportunities. So Ottawa really has been my home. And I come from a family where on my mother's side, no one had completed post-secondary education. My father was the first to do so on his side. So needless to say, no one in my family was in medicine. But I felt inspired to become a doctor and rather a surgeon by hearing that my paternal grandfather, had died of the disease ALS. And so that was my motivation since I was about 6 years old, where I felt I had to help people, that this would be my calling. And that continued all the way through childhood, teenage years, young adulthood. And when it came to learning about the heart in medical school, I fell in love with it. I loved the physiology. I just was so fascinated and interested in it. I loved studying it. So it felt like it was the right sign that, okay, I should explore this more. And I watched some surgeries in Calgary, and I actually emailed you out of the blue as a young medical student, asking if I could come watch you in the operating rooms in Ottawa. And you were so very kind and welcoming and said, yes, come spend time with us, come see what we do. And I realize now I didn't understand a lot of what was going on then, but I was so intrigued. I was so fascinated. I loved it. And it felt in my heart and in my gut that I should be a cardiac surgeon. This is meant for me. This is how I'm going to help people.
And you did really well. I still remember a little wink to all trainees in cardiovascular sciences and medicine. I think our first paper together you wrote in a couple of weeks or so, and I had a draft back in my email box very quickly, and it was extremely well perfected. There was not a lot to add, and it got published. So kudos to that, and that was really a very positive kind of introduction to what was about to follow, and certainly you've done extremely well, and we're very proud of you. Now, Donna, this background obviously brings a unique perspective to you, and you've chosen an extremely specialized field, and one which one may argue doesn't have a huge degree of penetration in northern communities, right? It's very likely that there's underservice with regards to providing cardiac surgery services, both with regards to valve disease, which must be more prevalent in northern communities than it is in major urban centers, and coronary artery disease. And even today in 2020, what are your thoughts with regards to that and the type of therapy and their availability to northern communities in Canada?
So I absolutely agree with you that northern communities, I think, are underserviced in terms of treatment that's offered, but it even goes back starting with diagnoses. So you can imagine if I have family members in a community that's fly-in only, where many weeks of the year you can't fly in or out because there might be blizzards or there's mechanical issues. I feel that contributes hugely to either misdiagnoses or diagnosing diseases at more advanced stages. And so maybe they have worse coronary artery disease if they, than if they had been diagnosed earlier, or very severe valvular disease. So there definitely, I think, is an issue with making the diagnoses. And then when it comes to treatment, it's difficult to then fly a person down from the north. You separate them from their family for many weeks at a time, especially if they have to undergo open heart surgery and they need to stay nearby for follow-up, or if they have major complications and their recovery is prolonged and delayed. So you have a person alone in a city that they don't know, separated from family. That poses a lot of challenges to the patient, and also in being able to deliver good care. How do you follow up with someone if they have a chronic problem and they live 3,000 kilometers away in the Arctic? It's challenging.